The Alaska Area Health Education Center program, we partnered with the ANSEP, the Alaska Native Science and Engineering program, to create a health science strand in their existing youth STEM program offerings. And the theme that we utilized throughout the first week was traumatic brain injury, to help students understand not only the clinical side of the medical field, but also some of the public health and behavioral health aspects of healthcare as well. We kept our students busy, very, very busy. The students explored all facets of the field, and they did so by working side by side with healthcare professionals. They learned to take vital signs with the guidance of registered nurses using hands-on equipment like stethoscopes, blood pressure monitors, in a facility that mimicked an actual exam room, which really helped the students get a feel for what it's like to be a healthcare provider. They also were able to tour LifeMed Alaska, our air ambulance services here in the state. They opened their doors of their air hangar for hands-on tours of their facility, their aircraft, their equipment, with a really great tour guide. Really got into the necessity of the services that LifeMed Alaska provides for Alaskans across the state. They also explored occupational therapy, with the UAA faculty members teaching students the basics of therapeutic techniques by using the professional equipment that they use in training college-level students. Students were able to dissect sheep brains, that gave them a glimpse of the coursework in future anatomy and physiology courses, something most middle schoolers won't get to do until they're well into their high school careers. Our partners at ANTHC, they provided a junior paramedic training, which included take-home kits of mannequins that the students would be able to use to practice and teach CPR to their family members and friends. The students also learned basic first aid and bleeding control techniques to help them be more prepared for an emergency situation. Also glimpses at things that most middle schoolers do not get the opportunity to experience. Students explored physical therapy by taking part in simulations and tests that are used with patients in rehabilitation. A lot of students really enjoy the physical aspects of healthcare, and this was a great experience for them. Our partners at ANTHC also allowed students to utilize telemedicine equipment, which simulates what rural healthcare really looks like in modern-day technology. Those tools are an essential piece of the well-being of Alaska's most isolated residents. Students were also exploring the field of speech-language pathology. They had to see what it would be like to speak without using words.
I want to be a neurosurgeon or a neuroscientist when I grow up, and I want to study in the health field, and I want to help people that have traumatic brain injury later on. Just help people overall, like maybe be a radiologist, take CT scans.
I want to become a health aide just to help out my village, or maybe become a doctor.
Brain surgeon.
Brain surgeon. Awesome. You too?
I like the physical part, like the therapy and stuff.
I'm going to be a pediatric surgeon with a specialty in rheumators.
So is this something you want to use professionally?
Psychology, yes.
So what are you thinking of doing?
I don't know right now. Maybe work with adolescents.
Cool.
But it's not mandatory.
I think I'm actually.
It's all good.
Walk very slow. Where are we?